So, hello everyone. Good morning, good afternoon, good evening. This is Zabunisa Kareem from Pakistan, co-chair leading Eastern Mediterranean Hub from Nursing Now. Thank you so much for joining. Thank you so much for joining everyone globally, whoever and wherever from you are. And I hope you will have a benefit, informative, and enjoyable webinar from us. Today we have Amy Staley as a clinical nurse manager of an orthopedic and vascular medical surgical unit from New York Presbyterian Hospital. She is a co-chair Nursing and Challenges Committee. She graduated her master's degree in advanced clinical management and leadership, and she has notable work taken place in collaboration with WI, Johnson & Johnson, and various capacities. Then we have Sanagul. Sanagul is my partner, co-chair Eastern Mediterranean Hub. She is also from Pakistan, but she is now in United Kingdom and studying postgraduate midwifery at the University of Birmingham. She has a diversified experience in nursing and also leadership. Leadership. She was a leadership participant and recipient from the nursing now. She is a fabulous midwife and a nurse. She represented nurses and midwives at different collaborations and in the organizations such as WHO, Wish Foundation, at Harvard School of Public Health, Health Ministry of Pakistan, and many more. And lastly, our fabulous, our marvelous keynote speaker, Professor Aisha Hallway. She is a program director for Nursing Now Challenge, professor of nursing studies, University of Edinburgh. Aisha Holway is a professor and co-director of the Edinburgh Global Nursing Initiative, adjacent Professor John Hopkins School of Nursing. She is chair in nursing studies and a founder and co-director of the Edinburgh Global Nursing Initiative. With a personal research program spanning over 30 years, Professor Aisha's work has a particular focus on alcohol-related harm, global public health, workforce, and health policy. She also has a strong professional interest in personal professional leadership, health policy, and nurse political leadership. Thank you so much to the keynote speakers and to our members for facilitating us, our region, our Eastern region, and providing us informative session on how Eastern Mediterranean can grow, people can enroll in this committee and be a part of nursing now. I'll ask Amy to take over and start.
Thank you so much, Zabe. Good morning, everyone. Good afternoon and good evening. My name is Amy Staley, and as Zabe mentioned, I currently work in New York City as a clinical nurse manager and also serve as co-chair of the Nursing Now Challengers Committee, where we work to empower and amplify the voices of nurses globally. I was first invited to join the Nursing Now network a few years ago, and when I first joined, I met a nurse named Harriet. And Harriet was a midwife in Uganda who dreamed about reducing maternal and child mortality and morbidity by supporting and educating teens. Today, Harriet is a leader, an advocate, and director of her very own charity, where she works to facilitate care and advocacy between midwives and individuals within the community. I then met a nurse named Amy, whose desire to improve the nursing profession on a global scale from a small city in Mexico drove her all the way to the United Nations. Shortly thereafter, I met Sana and Zabe, and Sana and Zabe share something very, very special. That something special is an unwavering commitment to the nursing profession on both a community level in Pakistan and global level as Nursing Now regional hub leads for the Eastern Mediterranean region. When I met Harriet, Zabe, and Sana, I initially thought that their stories were crazy, unrealistic, and something that would just never happen to any nurse. However, as my involvement with the Nursing Now Challengers Committee grew, my voice and impact continued to grow as well. And suddenly I was no longer advocating for my patients at the bedside, but also on these global forums and stages and in rooms with presidents and ministers of health where decisions were being made. And I had always believed that nurses belonged in these rooms. I just never knew that they would be us. So the Nursing Now Challengers Committee is made up of 6 regional hubs to represent each of the WHO regions: the Americas, Africa, Eastern Mediterranean, which we're talking about today, Europe, Southeast Asia, and Western Pacific. Within each of these hubs, individuals are provided with access to a unique network and the ability to connect with the best nurses and nurse leaders all around the globe. Several individuals within these hubs have had an impact on real change within the World Health Organization, the Africa CDC, ministries of health, and other government and policymaking organizations within their respective regions. Sana, who you'll hear from later today, has a really, really amazing story. So in addition to this network of nursing colleagues, as a member of the Challengers Committee, you'll gain access to the Nursing Now board, which consists of nursing leaders who collectively hold much more experience than we could fit into this webinar. Additionally, you'll have a look at first initiatives, challenges, and networking opportunities. So some initiatives that we've taken part in the past include our Voices for Vaccines Challenge, Health Action Trainings, our Global Book Club, which is still ongoing and really, really special, and so many more things that are continuing to unfold. Just this morning, we had another webinar to introduce a brand new initiative surrounding the WHO's Pandemic Accord, where nurses will be given the opportunity to prevent the spread of misinformation. So following this, I would definitely recommend looking into that and seeing how you can also apply to be a part of these really, really special challenges. The opportunities to grow your career within this network truly remain unmatched. However, if I had to choose my favorite part about being a member of this community, it would by far be hearing the stories and voices of our empowering members. Today, I no longer see Harriet, Zabe, and Sana's stories as crazy, unrealistic, or unattainable. I see them as stories of Nursing Now Challengers Committee, regional hubs, leads, and members. And I hope that when you hear our stories today, that you see a piece of yourself as well. The entire nursing profession is historically built upon other nurses growing, developing, and empowering entire nations because of other nurses who inspired them to do something bigger than themselves. When I look at the future of nursing and the future of this region, it looks like each of you. And I hope that you'll accept our invitation to join the Nursing Now Challengers Committee, Eastern Mediterranean region. I look forward to amplifying your voices, stories, and advocacy work. And if you're interested in joining, we would love to hear from you. We'll share the information in the chat box on how you can join this incredible committee. And please feel welcome to reach out. Thank you so much.
Thank you so much, Amy. That was a wonderful story of Harriet, me, and Sana, and how we uplifted the Eastern region and many other countries, and how you are motivated by joining Nursing Now and different initiatives of the Nursing Now. That was an amazing thing. And yes, everyone, if you want to reach out to us and want to join Eastern region, please see our chat box. There are links that how you can contact us and join Nursing Now. Now, I would like to invite Sana Gol to share her journey with the Nursing Now. Sana, over to you.
Thank you, Zabe. Thank you, Amy. That was amazing. Welcome, everybody. Khush Hamadid from Pakistan, Washatke from Iran, and Afghanistan, Marhaba from our Eastern Mediterranean region, Arab countries. So I am Sana Gul. I'm co-chair for the Eastern Mediterranean region along with Zabe, and we cover 21 countries in the Eastern Mediterranean region. So I'm just going to share a small slideshow because I want you to see the pictures of my journey with Nursing Now. So I hope it's visible to everyone. Yeah. So these are the countries that we cover in Eastern Mediterranean region. So if you're watching from Iran, Afghanistan, Pakistan, Syria, Jordan, Saudi Arabia, UAE, Oman, Yemen, Egypt, Sudan, Libya, Tunisia, Lebanon, Somalia, Morocco, please get in touch with us and join our Challengers Committee for Eastern Mediterranean region. We need you and you need us as well. So my journey began on January 8, 2019. I don't forget that day. I was the class representative. I was the first year BSN student in my final year. I was still in awe. Why I'm doing this? Can I quit? Because I came from a family or a community where nursing is not thought to be the best profession for a girl child to go. I still remember someone coming, a far uncle coming and telling my mom, she's a Baloch girl. She shouldn't be doing nursing. Because when the area, the families got to know that I got admission in one of the prestigious university, one of the best in Asia, in Pakistan for nursing studies, they were not happy. They were not happy, and they tried their best for me to not go for it. But I had to go because I had some amazing friends who would show me that this is an amazing profession if you have the liking of public health and the patient care. So nursing is for you. I followed my heart without following anyone's health view, and I jumped into it. But the reality hit hard. When I started, I saw that nurses have little to no respect in the hospital we're working in. It was very hierarchy. There was a status quo, and we were treated not as professional but as assistants who just follow orders and have no knowledge of what we do. I had two options when I was in third year. I remember myself crying in the corridor and telling the charge nurse I just want to quit because I felt so bad being treated in the consultant room. At that point, I contacted back my mom that should I quit because I was in the third year and it was just one more year to get graduated and become a nurse. Then I met one of my mental health mentor who was our faculty in management and leadership, and she told me there is a world behind that corridor, and you have two options: you quit or you change that status quo. I became as part of the curriculum representative that time. I must give credit to my university for enabling me to do this work that I'm today doing. They told me there's a Nursing Now campaign, which is actually working for challenging the status quo, and they are launching in Pakistan next year. So if you're interested to show your journey and present young nurses in Health Ministry of Pakistan along with Nursing Now launch, you are more than welcome. And they supported me to travel to the capital of Pakistan and represent there. That was a changing moment for me. I got to know about Nursing Now. The president of Pakistan declared 2019 as the Year of Nurses and Midwives. I was greeted and congratulated from so many senior nurses locally and globally for being there as a young nurse. That was it. It sparked my journey to motivate other young nurses and to tell them, you're not there to quit. You need to challenge that status quo, and you're more than what you are. Since then, the journey began. Nursing Now gave me so many opportunities and enabling environment to flourish that the idea of advocating for a better pay, better work environment, better recognition for nurses and midwives. Through different collaboration from Nursing Now, as a young nurse, I was invited for the first ever WHO COVID-19 press event in 2020, where I talked on vaccine equity. Moving forward, there were so many different trainings that I got an opportunity to work at, to join the Harvard School of Public Health as Department of Nursing Dean for the launch of the leadership program for nurses and midwives. I was awarded as the leadership young leader for Nursing Now in 2022 for my work. And then the amazing thing happened that we got selected for a wonderful opportunity to attend the World Health Assembly in WHO's 75th, but because of the COVID, we were not able to attend it in person. Then we were given a week-long online workshop along with the Wish Foundation Qatar, where we had a long 1 week training workshop about pre-World Health Assembly works, that what happens at the global level. Fast forward, in 2023, just next year, I got the opportunity to attend it in person with an amazing 6 young nurses all around the world in the direct mentorship of Aisha, and then our amazing colleagues from Wish Foundation, where we actually got an opportunity to present an intervention on the health workforce in the World Health Assembly. And this doesn't stop there. Same year in September, I was invited in an event in London to share my story. And next week, I'm going to another international conference with Aisha to talk about my journey. So in this small presentation, I cannot cover everything that I did and was part of in last 5 years, but I must tell you, I am a completely different person from that Sana, which was crying in the corridor, telling everyone I want to quit, to now that I want to educate and encourage other early career nurses and midwives that you can do it. So how I got all of this? There are 4 questions that you need to ask about yourself. Do you have the motivation to promote nursing and midwifery leadership agenda? Are you motivated from inside? Do you want to challenge that status quo? Are you keen to represent early career nurses and midwives? And of course, the commitment to time. Because we are not getting a pay slip for being in the Nursing Now Challenge, but it pay off you in different ways. It pay off you in your leadership development, in your networking skills, and lots of different opportunities, which has no monetary value. It is more far than that. So if you come in these four, your answer is yes to these four questions, then Nursing Now is the place you should be. It gives you that enabling environment. It gives you direct mentorship, leadership development opportunities, lots of networking opportunities to achieve all of this, to make a real change in your local hospitals, in your communities, regionally as well as globally. So join us today. You have all the information in the chat box. Me, Zabe, Amy, Aisha, we all are in Twitter, LinkedIn. You can connect to us in social media, and we are more than happy to answer your questions. Thank you.
Thank you, Sana. That was an amazing story, and I can see lots of clapping and hearts on the chat box and on the screen. Yes, that was quite a full journey, lots of ups and downs, and you got to meet with the president of the Pakistan and the Nursing Now year, and a lot of things happened in UK. You attended WHO, and that was an amazing, eventful journey. So I am sure and hopeful that many students and early career nurses and even all the nurses in the Eastern Mediterranean, our country, globally, got inspired with your journey, with your story, and come forward and take initiative, break the status quo, be more voiceful, have heard their voices, and be more, talk and whatever they want to change. So thank you so much for everything, sir, that you have done for us and been doing. Now it's time for Professor Aisha to take over and tell us more about Nursing Now, what we can do, how we can be a team and work towards Nursing Now and improving of the nursing profession. So Professor Aisha, over to you.
Thank you so much. And thank you, first of all, to all our attendees who've taken time out of their very busy schedules to hear more about the Nursing Now Challenge, listen to the wonderful Amy and Sana, who are inspiration to all of us. And hopefully at the end of this session, you will want to be part of this most wonderful, wonderful global community that really is about friendship, kinship, and supporting each other. And it's just such an honor hearing Sana and Amy and Zabe speak and enact every day the thing that is in them, and have found a way to be the very best version of themselves. And I hope that's what you would gain by joining the Nursing Now Challenge. So maybe for some of you who don't know, I'm based in Scotland at the University of Edinburgh. My clinical background as a nurse was in general medicine, acute medicine, and critical care, intensive care nursing. And I now work in academia and education and research, but my research is still very clinically based. And the most wonderful bit is the professional element to it, where I get the opportunity to engage with young early career nurses and midwives, and how they operate within a global health policy context. So my journey with Nursing Now Challenge started several years ago with the Triple Impact Report, before Nursing Now even was a thing. And my career has been about the generosity of other people and the opportunities they've given me. It's the biggest lesson I have learned. It's the most important piece of information that I carry with me forward every day. And without those people, those trailblazers, those nurses and other non-nurses who saw something in me and believed in me, that I'm where I am now. And I think that is the most important thing I can say to you, is that when you come to Nursing Now Challenge, we believe in you. And that is a very freeing thing to be told, I think. Personally, I found that, because a lot of the time and still now, I think about all the things I'm not sure about myself, or the things that I don't know, or am I good enough, or do I know enough, etc. Those things still stay with me because they're part of who I am. And the strength that you get and the confidence that you get to move forward comes from yourself, absolutely, in your own personal development, but also in others who walk with you on that journey. And both of those are things that I've managed to get from being part of the Nursing Now campaign and now the Nursing Now Challenge. And the Triple Impact Report, I mentioned that because that really was the catalyst to the Nursing Now campaign. And I was given the opportunity to write evidence for the Triple Impact Report around leadership and policy, and how nurses must be in that room, in these discussions, not just implementers, but in people informing, writing, and influencing policy. And then I was lucky enough to get another opportunity of being the Programme Director for Research and Evidence for Nursing Now. And then moving forward, when the Nursing Now campaign transitioned and the Nightingale Challenge became the Nursing Now Challenge, I was offered the opportunity to sit on the advisory board, which I did. And the Nursing Now Challenge continued under the leadership of Lisa Bayliss-Pratt. And when she moved on after a few years, having done a fantastic job with the challenge, I again was given an opportunity through the generosity of others to take on the role. And it has been one of the biggest privileges of my career and my life. And working with people like Amy, Sana, Zabe, all the most amazing, amazing young nurses and midwives, it just is, it makes my heart sing, is the thing I talk about. And there's a phrase that you should never go to your grave with your music unplayed. And for me, my music gets to play every day that I do this job. And that's not because of what I do, but that's because of what these early career nurses are doing and midwives are doing every day as part of Nursing Now Challenge. So what does this global community look like? What do we offer? We cross over 6 regions that are the same as the World Health Organization regions. And so we have the Euro region, we have Eastern Mediterranean, and actually this is a very special region because this is a region that we have really sat together and thought, this is a region that is untapped. It has untapped potential in its early career nurses and midwives. And we want to open that opportunity up to the art of possibility. What is possible for the Eastern Mediterranean region? And what is possible is up to you. We can embrace you, we can bring you into Nursing Now Challenge. And then the most wonderful thing is, nobody is going to tell you what to do. All we do is we support you, we hear your ideas, we facilitate, we lift you up, we provide you with opportunities, we strengthen your skill set, and you will never walk alone again if you are part of the Nursing Now Challenge. So it's a place that will feel like home to you. It will be a place that you feel that you belong, maybe sometimes for the very first time. A bit like Sana said, I think all of us who are within the Nursing Now Challenge have felt very lonely. And I certainly did for many years in my career, till I was in my 40s. I still did not feel like I'd found a place that I belonged because I was frustrated with everything I saw. I felt there was no one there to listen to me. I couldn't find a way forward. I didn't look like everyone else. My behavior wasn't the same as everyone else as a disruptor. So it was or a questioner or someone who wanted to make a difference and just couldn't see why everyone else was not doing that. But what Nursing Now Challenge offers is that place that for once you will feel like you have come home and you are part of something, and other people think as you do, want to achieve the things that you do, they want to support you. And that is very difficult to find, I think, for us as a profession. People want to keep us down, we are undervalued, or we are valued, but we're valued within a particular context and box that people want to keep us in. And we don't want to do that. And the great thing about Nursing Now Challenge, it's about collaboration, it's about partnership. This is not about us going against the rest of the world. This is about us taking kindness, generosity, our values forward and showing people that we can do that through collaboration, through kindness, and together we can make a difference. So we've given particular focus and a spotlight on the Eastern Mediterranean region, and myself and Shirley Baines, the Chief Exec of Burdett, were in the Middle East at the end of last year. We have now got some newer colleagues within these positions of leadership for our regional hubs. And we have Amy, who sits on our advisory board and oversees across all the regional hubs. So we're really showing our commitment to this region. And thank you for your commitment today to us by coming to listen to what we have to say. But I want to stress, we are not here to tell you what we want you to do. We are here to tell you what we offer. You come and you become the best version of yourself with what you want to do together. So the Nursing Now Challenge is a very small but wonderful team. There is Hannah and Faye, who are there in the background today, making sure all of this works. And because we're a small team, we tend to know most people. We don't know the 60,000 people, but we have a Challengers Committee, and that has a particular function. And there is a smaller group of individuals who really are driving forward the Nursing Now Challenge, bringing everyone else with them. And as you know, being the leader is not the most important person. The followers are. Everyone else who are not following, but they're leading themselves with you. And that's what we're looking for. We're looking to provide that environment where you can flourish. So if you join, and it's an easy process online, you will then be part of your region, and you will receive updates regularly about the activities that happen. Now, there are different types of things going on. There is opportunity for personal and professional development. So we have health action training, which is about it's helping you actually understand who you are, because the most important person you will ever lead is yourself. And we can tell you it is hard out there. It's hard in the job that we do every day. The emotional labour of nursing is intense, and it has been never more intense than it is now in the geopolitical landscape and climate. We have just come out of a pandemic. We look around us, there is conflict everywhere. And even for someone like me, my father is from Sudan, from Khartoum, my mother's from Scotland, and the conflict in Sudan, Gaza, Myanmar, it is everywhere. And we as health professionals are working in that type of environment every day. So the moral injury experience is very significant for us. And we have to acknowledge that, and we have to point that out. Despite this, there is a safe haven in Nursing Now Challenge. And this is where you can find rest and nourishment and encouragement and development of yourself. And the health action training is a wonderful opportunity for you to have some time where you are the focus and help you understand who you are, understand your weaknesses, your strengths, and how you can utilize both of those to your advantage and help you moving forward. So there's those elements. There's no payment for it. There are different levels. You can go in and just listen to a webinar, or you can actually do the more formal training and become a trainer. So there's that element. There's other elements where you can network. And networking cannot be underestimated. Networking is part of our job. Not only does it provide us with an opportunity to connect with others, but it allows us to be what I would call a broker, where we can connect other people. So the networking is not for your benefit, it's for everyone else's benefit, because you never know who you might be able to meet and connect someone else with. And despite us understanding there are billions of people in this world, it remains a very small world, because usually somebody will know somebody will know somebody who knows you. And that's how it works in nursing. So there's the networking, not just within your region. Your region is very interesting because it is so vast, it's so diverse, and we're not saying that you're all the same at all. It's just that the regions tend to work with WHO, and that helps us actually access things that are going on at a more global level. So you can network within your region, but you can also network outside in the other regions that exist. If you want to get in touch with someone else, if you want to be connected, and we've seen that we've got Amy in New York, we've got connected with somebody in Indonesia or someone in Africa, and we are all a big family. So you can find out about what's going on elsewhere in the world. The other thing that is also available is mentorship. And that comes, I would say, informally, but it is possible through your networks that could become a formal thing. And we would strongly encourage that, to seek out those who will support you in your career. And I know both Sana and Amy particularly, I know, and Zaid probably has benefited from wonderful mentorship from others who have been generous with their time. And here's the most amazing thing. You will be inspiring and mentors to others even now. And again, that's about us helping you fulfill your potential, because every generation that comes through, every cohort that comes through, in fact, we shouldn't talk about generations, because a generation is too long to wait. We have to be doing it now. So every cohort, every entry of student nurse midwife that comes through, we need to engage them. And we have universities as part of Nursing Now Challenge also, because we want this to be a normal thing for nurses. There is the Global Solutions Initiative, and some of you may have joined us this morning, where we've worked with the World Health Organization, and we're looking at disinformation and misinformation. Please, if you didn't attend this morning, look on YouTube. Hannah might put it in the chat, and you can actually find out what went on this morning. And the Global Solution Initiative is an opportunity for you to put your innovation and your ideas into action and then see what happens with them. And Amy gave us a fantastic account of how she had done that previously as a vaccination ambassador, and was able to go all the way to the UN with that experience that she had. So we also have that as part of Nursing Now Challenge. We have our Global Book Club, which is an opportunity for those of you who want to, hang on just a little minute. Sorry, it's just a little bit of noise there. The Global Book Club, which we had our very first inaugural Global Book Club with Sarah de Gregoria, who is based in New York, around her book, which talks about the power of nursing. Again, you can access those recordings already, and we've got our next book club in May, where we're looking at health economics. And you might think, oh, golly, what's that got to do? I don't know anything about health economics. But actually, this is just about how is the world financed in terms of health, and why are nurses really important to that? If there's 28 million nurses, health is probably what the largest budget coming out of your government. And yes, we do have to have a say in that. And because of the shortages there are with nurses, etc., this is definitely a time for us to consider the impact of what we would call a well-being economy, where everyone is treated with equality, and where governments have to start thinking about not multiple tiers of people and communities, but of one tier where we all have access to health, if we think of universal health coverage. So Catherine Trebek will be doing that one in May. trying to think of the other things that we have. We've got so many things on the go. We also have our webinars, or our debates, as we call, during the year. There'll be several of those during the year that you can join anytime you want to. And again, they are recorded, so you have access to them. And there are also other opportunities. So the big thing, I think, for us this coming year and next year is the fact that there is a second State of the World's Nursing Report. And that sits alongside the SDNM, which is the Strategic Directions for Nursing and Midwifery. So the first State of the World's Nursing Report, which came out a couple of years ago, gave us a global profile of the nursing workforce. First time we've ever had that done. The second one is currently being worked on as we speak, and hopefully some of our members will be attending some of the workshops that are going on globally, where they are working with the GCNMOs, the government chief nursing officers, and other colleagues in ICN, in regulatory bodies and associations, working together to try and get the best quality data, workforce data, to inform and to feed into the second State of the World's Nursing Report. And that is a mandate from the World Health Assembly. The member states have signed up to this. And from the last one, the global chief nurses together came up with the strategic directions for nursing and midwifery, which are 12 priority areas. If you've not read this, we can pop that in the chat for you, but it's very interesting because that is really the policy document that governments should be working towards around education, leadership, patient care. All of those things are wrapped up in those 12 policy documents. So we're quite keen to be part of that, and we're lucky enough to have that coming forward this year and next year. Next year will be the publication of the State of the World's Nursing Report. So these are just, I guess, a snapshot of the things that we're interested in. You can join as an individual. Our preference really is that you join as an organisation. If that's not possible for you, we can support you in engaging with your organisation so that we can get them on board. But if we get them on board, that means you have a network around you and a system and a structure that hopefully will be supporting you. But we understand that's not always the case. So that's why you can come and join us as a single individual person. I think that's all I want to say, because we've got just a few minutes left, and maybe Sana, Amy and Zabe want to say something else, but hopefully that will have given you a bit of a snapshot. I think one of the things that I like to say, I like to say a lot of things actually, but we talked about it this morning. If you want to see what your career is going to be like in 5 years' time, look at what you're saying and doing now. And that's what we want to say. So now is your moment, now is your opportunity. And hopefully, I think we prioritize you. And Maya Angelou once said, never prioritize anyone who sees you as an option. We don't see you as an option, we see you as a priority. So we're going to prioritize you, you prioritize us and join today. Thank you so much.
Thank you so much, Dr. Aisha, Professor Aisha. That was an amazing and a really descriptive about nursing now and its events and what had happened and what will happen and how we can engage in nursing now. So participants, everybody who is listening to us and who is seeing us joining this webinar, please here are some few points from Professor Aisha about believe in yourself. If you want to break the status quo, if you want to be something and be a nurse in your profession, for your country, for yourself, believe in yourself. And here our team, our members for support you, for your help and facilitation. Bring your ideas to the table and we will surely support you. Network, network, and network. Network will bring you to out of your shell and to communicate, and what you are thinking, that would be fulfilled when you network, when you meet with the people and you share your ideas and your innovations and your interventions, solutions, whatever you want to do. Mentoring, there are so many people who are experience in diversify field. As you can see, our panelists, our speakers, and many more in nursing now, and various in your own organization, in your own circle. Find out, come out from your little shell and wherever you are, and see and find out your mentors, talk to the people, what you want to be, how you can bring change. Collaborations with different universities, platforms. We have our global book club that Professor Aisha talk about, our researches, our publications, and what we are doing, our webinars, and our global research that we are working on it, and hopefully will get through it as well. The amazing part is our International Nurses Day theme is also economic care, nurses and economic care, economic power of the care. So the book club that the Professor Asha talked about, health economics, is very, very crucial for everyone. As being nurse, you should know about health economics and how it affects nursing and your country and your population. So there are many, many things that Professor Aisha talk about, Amy talk about, and of course Sana's journey throughout from start till up to now, how it inspires you. So I hope every individual, every participant, and everyone in this webinar who joined or who would watch the recorded session would get inspired and will join nursing now. Bring your ideas, and as the people are talking in the chat that how they can join, so please, we have social handles, we are everywhere on Twitter, on LinkedIn, on Facebook. The links are already shared on the chat box, emails are shared on the chat box, how you can join the registrations link, and of course our webinars little feedback. So we would want to hear from you the how our webinar went and what more you want us to come up with, different topics or anything that you want. It could be anything, online workshop, anything that you want to learn, be mentor, leadership, anything. So we have a lot of things to do, to give. So it's just you want to ask that what we can do. So thank you so much, everyone, Amy, Sana, and Professor Aisha. If there are any questions on the chat, so we can have it in a 1 minute or two. So there are no specific questions. So thank you so much, everyone, every participant. Thank you, speakers. If there are any last minute, closing minute remarks from Amy, Sana, so you could please share with us. Okay, thank you so much. So yes, Professor Aisha, yes.
Laura, I was just wondering, do we have in the chat the link to where people can join?
Yes.
Yes, well, I think the contact details are there. About
Yes,
if you've
yes.
got any, yeah, lovely. Thank you so much.
Yes,
Thank
yes.
you, Hannah.
Thank you. So Hannah and Fi has shared all the links of Nursing Now and different links for joining the committees and Nursing Now and different challenges. May I request everyone to open their cameras for a group picture, and then we can formally close our webinar. So may I request Hannah if she can take picture of us, or Fi, if you can take the picture of us.
Yep, that's done. Thanks, Dave.
Thank you so much, Fi. Hannah is our director for external relations and fire member and nursing now committee member, supporting us from behind the curtains. And thank you so much, everyone, Amy, Sana, and Professor Aisha. See you next time with an amazing topic again. Thank you so much. Bye-bye. Bye-bye.